of discussion, Henoch-Schönlein Purpura. Remember, the other names of the diseases are very important. This is also called as anaphylactoid purpura, or this is also called as small vessel vasculitis. Which type of small vessel vasculitis? It is IgA, small vessel vasculitis. So basically, inflammation of the blood vessels is going to be there in the pathogenesis. Very important. In the investigation, we'll again see this. So this is going to affect children and young adults, and it is a self-limiting condition, and there will be 4 important systems which are going to be affected. Of course, one is the skin in the form of palpable purpuric lesions, and the patients are also going to have a joint involvement leading to arthritis, arthralgia. There will be also involvement of the GI system, which is going to produce abdominal pain, and renal involvement will be there. So in the skin, remember, the patients are going to have this palpable purpuric lesions, and I hope all of you know what are purpuric lesions. So if you have not yet watched this, I have made a video on skin lesions, so you can check the link. I will leave them in the description in the comment section. So these palpable purpuric lesions the patients are going to have in the extremities, mainly lower extremities, and also in the buttocks. Okay, and these are basically differentiated from erythema with the help of diascopy, which is also called as vitropression, application of the pressure with the glass slide, where the purpuric lesion, the erythema will be persisting, and in the case of erythema, the erythema is going to blanch, it is going to become white on application of the pressure with glass slide. Okay, so the patients are going to have the skin changes because of the underlying vasculitis, and reason for the abdominal symptoms is again the vasculitis. What are the symptoms? There will be colicky pain, and also there can be bleeding, and arthritis, arthralgia. The knee and ankle joints are most important, which are going to be affected. Renal involvement, hematuria, proteinuria, and also there can be cast which can be seen, and there can be ultimately renal failure. That is the reason why we have to monitor these patients very carefully and closely. Okay, so this video, if it was helpful, please do hit that like button. Please do not leave the video without hitting that like button. So what are the investigations which are going to do? ESR and CRP, they are going to be elevated, and also we can see that IgA levels may be elevated because this is the IgA small vessel vasculitis. And of course, renal function test abnormalities can be seen, proteinuria can be seen, and if you take a small biopsy of the skin, we can see that there will be IgA deposition. Remember, biopsy, after which we have to do immunofluorescence. Okay, immunofluorescence is going to reveal the deposition of the IgA, not only in the skin but also in the kidneys. Also we can see this IgA deposition. So in this picture you can clearly see the IgA vasculitis, that is Henoch-Schönlein purpura, where the inflammation of the glomerular capillaries, the small blood vessels of the kidneys, it is going to show on direct immunofluorescence IgA deposition. And also in the skin you can see there will be inflammation of the blood vessels, and if you observe the immunofluorescence, it is again going to show the same IgA deposits. Okay, so coming to the treatment part, steroids are the effective treatment for the GI system and also joint involvement, and the renal involvement treatment should be very aggressive in the form of IV steroids, and also other immunosuppressants like cyclophosphamide and azathioprine can also be used. Plasmapheresis may be used if the